infestation, they suck the blood. Besides sucking the blood, from the injuries they cause in the intestine, there's also bleeding. So you are losing blood to them, and the blood is also going out through bleeding.
Africa Humanitarian Action is a non-governmental organization that currently implements health and nutrition services in Nachivale refugee settlement.
This is an organization, a Pan-African international organization that is operating in about 14 to 15 countries in Africa, mainly providing healthcare and other basic services to communities that are in need of basic services, such as health, food security, and the like.
Several surveys were done, nutritional surveys, including surveys for anemia. And overall, we found more than 50% of the populations were having anemia. And this concerned the High Commissioner for Refugees, and he decided to set up a special fund to combat anemia.
A lot of things that we covered, we were able to see the variable foods that we find in our market and the foods that we can grow locally in our community. And we had also some practicums on how to prepare some food which is very rich in irons, especially foods for, we look at different categories. We looked at weaning babies. Those are babies from 6 months going to 2 years. And we look at pregnant mothers, the food items that they can eat to enrich their foods with irons.
I achieved something about the iron foods, which at my local level, which I should always look at the most available and affordable, which are the plants. Those are the non-heme ions, which are the most affordable at the village level. And as far as I was able to know about the heme ions, which are the animal products, which also carry a higher percentage of the iron.
These were participants of the workshop organized by AHA that provided extensive training on infant and young child practices, on how to conduct monitoring and evaluation of nutrition-related issues, and on how to conduct field-level demonstrations. The overall goal of the workshop is to train health officers and nutrition assistants to improve the quality of life in more than 9 settlements in Uganda.
The most critical beneficiaries of our intervention, as you are aware, will be basically women and children. Anemia is a serious problem during pregnancy when it comes to women, but we'll try to look at all women within the reproductive age group. By doing that, we believe that we'll also capture pregnant women as well. And we'll also look at children. Basically, we tend to consider children of under the age of 5, but for our purposes here, we will make even further focus on children under the age of 2 that we classify as infants and young children.
Quite a number of professionals took part in the proceedings of the workshop.
We did delighted to be part of this, not training, but part of this workshop or seminar. It's a real opportunity. There are many people, many other people could have been chosen to come and be part of this workshop. But we are the ones, we are the chosen few that have, come up.
You're going to go back and train health workers, but you're also going to continue with the community component. So you need to try and make sure that whenever you go back, you have the clarifications, you're clear on what you're going to tell them. So how do you get it clear? It's only when you're here. You're going to be ambassadors. We will expect you to help lead the community sensitization. You have the community health workers, but you helped organize.
Iodine was supplementing the salt. It has now hit 98% in the whole country. And we are saying also, if possible, we can promote fortified cereal flours, flours rich in iron. Maternal, infant, and young child nutrition. We shall know from this lecture that breastfeeding is gold. You've heard about that message. That everything, the breast milk is the wonderful. It is the only food you can find in the world. which has all the nutrients for human survival, including immune factors.
Margaret attended the workshop. She's at a medical center in the refugee settlement, practicing the acquired skills.
Tuambia unapasha kunyonyesha mtoto kwa siku nzima tu 12. Kumnyonyesha mpaka yeye pekee anasikia na shiba anaacha.
The training workshop is part of a capacity building effort which AHA designed in its anemia prevention and management program.
Nutrition is not an affair that you can